From Penn State Health, this is Ask Us Anything About the Ronald McDonald House. I'm Scott Gilbert. This place is truly a home away from home for families of children who are receiving treatment at Penn State Children's Hospital. Today on Ask Us Anything About, we're going to be learning about this amazing place and the work that they do here throughout central Pennsylvania and even all across the world. And here to start that conversation with us is Carla Mitchell. She's the executive director here at the Ronald McDonald House. Thanks for being here today.
Thank you, Scott. Welcome. We're glad to have you.
Well, let's start by talking about the Ronald McDonald House. And I mean, for people who may not be familiar with it, how big is it and who is it for?
Yeah, so the Ronald McDonald House here in Hershey is a 35-bedroom home. It serves families, as you mentioned, whose children are receiving critical medical care over at Penn State Health Children's Hospital. 35 bedrooms is quite large. It's about 32,000 square feet. And it has bedrooms and living rooms and dining rooms and kitchens, just like your house and mine. The idea is it's just a bigger of a scale for those families to be able to utilize those services. There's a playroom and computer services and food pantries and all those types of basic amenities that the families would need, so they don't have to worry about those while they're here. They can focus on their child, they can focus on themselves, and help be able to provide a more compassionate and caring environment for those families.
That's great. And this house was built in 1984. It didn't look like this back then, though.
It did not. Originally, the house had 13 bedrooms. And then in the early 90s, we expanded again to 20 bedrooms. And just recently in 2010, we expanded again to now have the 35 that you see here today.
You're watching Ask Us Anything About the Ronald McDonald House from Penn State Health. I'm Scott Gilbert along with Carla Mitchell. She's the executive director here. We welcome your questions and comments. And we've gotten a lot of great comments already from the Facebook post we put up prior to this to let folks know that this interview would be happening. You must get a lot of great feedback. People must really appreciate what you do here and how you do provide this home for families.
Yeah, we're really lucky. A couple things come into play there. One, we have a great dedicated staff and volunteers. They're amazing. We have a great partnership with the medical community, and they also are very good to us. Donors and families who've been here come back, and that speaks volumes, that they want to come back, they want to volunteer, they want to help us out. And so we're really grateful to the community for doing all that they do to help make this place so great.
Now, if someone who's watching has a child who will be receiving care in the near future at the Children's Hospital, what can they do to look into a possible stay here?
Yeah, they just need to give us a call. They can also check our website, but it's going to refer them here. And so they need to give our office a telephone call, and the staff, when they answer, the volunteers, when they answer, will help walk them through that process. It's available to any family who pretty much lives more than 30 miles away from Hershey, and as long as their child's receiving care at the medical community and we have space, they're eligible to stay here.
Well, fantastic. You're watching Ask Us Anything About the Ronald McDonald House from Penn State Health. I'm Scott Gilbert. This is Carla Mitchell. And again, we welcome your questions and comments. And if you enjoy this content, we hope that you share the post on your Facebook page to help get the word out to even more people. As part of this, what's great is we get to move around in here. We get to see the place. And so we're going to be seeing a few rooms, and starting with this one. This is a lot of nice comfy couches, a lot of nice comfy chairs, kind of mellow lighting. Tell us a little bit about kind of the thought that goes into designing a space like this.
Sure. Well, the house at one point had a committee of volunteers, family members, facility type folks who really had comfort at the forefront. They really wanted to make the space as much of a home away from home as possible for the families when they're staying here. It's convenient and accessible and comfortable, but not over the top. You're not going to have some of those more significant privileges, but the idea is that there's that comfortable care, that family-centered care that we can provide here for them.
Fantastic. Well, let's take a little walk down the hall here, because I have to admit, this is my favorite room right down here on the left.
Mine too.
Yeah, well, and before we get to my favorite room, there's a little computer room over here, so people can log on and maybe even do some work, do some play.
That's correct. We have free Wi-Fi here, and for those families that need to log on to their computer to share the status of their family member as they're recovering or receiving services at the hospital, they can do that here. We also have a lot of parents that come and they're still working while their child is receiving care, so they're logging on, they're getting work done while their child is over at the Children's Hospital.
Fantastic. Okay, now my favorite room. I think it's also the most colorful room probably in this house. It's, of course, this playroom located just out off of the kitchens that we'll be seeing very shortly here. But a lot of fantastic toys, a lot of, oh my gosh, look at the size of that teddy bear. A lot of great things in here.
Yes, we are so blessed and so fortunate. I will tell you that the teddy bear, the big one that you see in the corner, actually was a gift from the teddy bear drop from the Hershey Bears from one of their games this past season. And 2 of the Hershey Bears players came in along with the bear to deliver it. So that was very cool and exciting. And they actually delivered a lot of the toys that you see over here from last year's teddy bear drop. This is a great space. It was a partnership between McDonald's, our founding partner, and also Hershey Entertainment and Resorts to be able to really make the construction of this room happen. And all of the colorful designs that you see on the walls are a wrap or a brand that Hershey Entertainment Resorts did for us. It is also the exact same wrap that you'll see on our hospitality carts over at the hospital. So there's a really good, consistent feeling of fun and happiness and care.
I'm glad you mentioned the hospital and the presence of the Ronald McDonald House over at the hospital, because there are a few different presences there. You have the Ronald McDonald Family Room, the hospitality card in the Children's Hospital. So let's start with the family room. Tell me about that. Yeah. It's on the 7th floor.
It is on the 7th floor of the medical center, and it's for any families who really want a bit of a respite. You know, they just need a break. They want to step away, but they don't necessarily want to leave the hospital environment. And so they can come up to the 7th floor in the medical community. They can take a nap, they can get a snack, they can just sit and read if they want to do that. They can watch TV. There's activities for smaller kids that they can do while they're there. And it's just really a great space. And it really is a home-like feeling for the families when they come in there. It's right next to the NICU, so we do get a lot of NICU families there, which is wonderful, but also from other patients over in the Children's Hospital. It's a great space.
Sure. So speaking of the Children's Hospital, on the 3rd and 4th floor, there are special rooms there as well.
Yeah, there are lounges that are in the Children's Hospital that Ronald McDonald House helps to support with staff from our family room. They provide the coffee from McDonald's and a few other resources there as well.
One of the coolest things we see in the hallways over the Children's Hospital is the hospitality cart, too. That must be a nice resource for families.
It's a terrific resource. And actually, as of just a couple weeks ago, we now have 2 hospitality carts. There's a large one, it's quite large, and a smaller one for a single volunteer who might be able to move that cart through the Children's Hospital if we have only one volunteer that day. The hospitality cart is very recognizable and provides a quick snack, a quick drink for a family member who just wants to come out of the room to the lounge area, to the hallway out there, the foyer, where they can just grab that from the cart and then, head back. We also have sometimes reading materials for the adults because, let's face it, you're waiting. And so providing that to them, giving them that opportunity or crossword puzzle or something like that helps, bide their time is really beneficial to them.
Fantastic. Great. Karla, anything else to share before we move toward the kitchen? Just anything in general about the house that we haven't touched on?
Yeah, I don't think so. We're very grateful. Families who come here are beyond grateful for the services that we provide to them and to their children, when they're here. And we're grateful to the community and our partners to help make that happen.
Carla Mitchell is Executive Director here at the Ronald McDonald House in Hershey. Karla, thanks so much for your time.
Yes, Scott, I really appreciate it. Thanks so much. And thanks to the viewers.
You bet. And by the way, we're about to meet somebody else, so don't tune out yet. And do feel free to keep the questions and comments coming. Just add them to the comment field below this Facebook post. Whether you're watching it live or if you're watching it on playback, we can get you some answers to any questions that you might have about this amazing facility and the amazing people who help it operate. And those people include Amy Leonard. She's Development Manager here at the Ronald McDonald House in Hershey. Amy, thanks for being here.
Thank you so much for having me.
We are in one of the 2 kitchens here. So as we continue our tour of the Ronald McDonald House, why don't you tell us a bit about what this kitchen's used for?
Sure. This kitchen actually is used for our baking program. So we have groups from the community that come in and they prepare baked goods for us. That could be cookies, muffins, anything that you can bake, and they provide those to us so that we can in turn provide those to the families. We use those here, and we use those across the street that are given out through the hospitality cart that you all just talked about. That is, one of the top things that the people tend to like to eat when they're in stressful situations. Baked goods, everybody likes them. So every day of the week we have volunteers coming in between breakfast and dinner using this kitchen. They bring all the items themselves, so they have to bring their brownie mixes, their cookie mixes, and then they prepare them here in the kitchen.
Fantastic. And this is, as I mentioned, one of two kitchens. So we're going to make our way over to the other one just across the way here. It looks somewhat similar to this, although it does look a little bit bigger. Is that possible? Is this a bit of a bigger kitchen on this side here?
It may be. It may be.
And this is for who uses this one?
This kitchen is used primarily for our guest chef program. So those are groups from the community that come in and prepare a meal. So they're preparing for at least 70 individuals. They're bringing the food with them. During the week we have dinner, and during the weekends we have breakfast and dinner. They can actually what the people before you and after you are preparing, so that you don't have hamburgers every day of the week, spaghetti every day of the week for the guests. It's really one of those things that's user friendly, and we would love to have more groups from the community engage with us in that way.
In the Facebook post promoting this video, we had a question from Donna. She asked about wish list items and things such as, what are the most common items that are needed, and also how does one go about donating?
At any given time, we have a short list as part of our wish list. That is a vast list of everything that we can possibly use or want here for our guest families. But the wish list, shorter list, provides things that we're low on. And currently, those items that we have on our short list is salty snacks. So that would be like individual serve bags of popcorn, chips, pretzels, veggie sticks, anything like that. Also, ravioli, spaghetti, individual serve microwavable meals. So they're like your Chef Boyardee or something similar to that, where a family is able to access that through the hospitality cart, microwave it over at the hospital, taking care of themselves again so that they can be involved in their child's care. And then the last thing that we are in need of is colored pencils. So it's very different. Every week it kind of changes, but Anne over at the hospital, which I know a lot of the folks that will be watching this know Anne. She's really good at keeping us updated on what supplies she needs to be able to provide to the large number of folks over at the Children's Hospital.
A lot of those resources for patients, but also for families. A lot of siblings stay here, so you got to keep them busy for sometimes long periods of time.
We do, and each child that comes and checks in, one of the things you'll see on our wish list is toys. So what we do with those, a lot of people don't know, is every child that comes in receives a toy from the treasure chest. So the volunteers are great at taking them over to the treasure chest, whether it's a sibling or the patient, and being able to provide them with the toy of their choice. We have a volunteer who that's her role, is she comes in and stocks the treasure chest with donations from the community. We have tutus in there that have been made by volunteers, and superhero capes and all kinds of fun stuff. But again, that's one of the ways that we can refocus maybe a negative situation to something a little bit positive temporarily for a child, to help mom and dad get a breather and be able to check in and get settled. So again, more than 30 years of history and volunteer input has brought us to this point where we feel like we can continue to provide what we provide, and then look ahead and see what's next. What more can we do for these families that need us during such a difficult time?
Great. You're watching Ask Us Anything About the Ronald McDonald House. I'm Scott Gilbert, talking with Amy Leonard. She is Development Manager here at the Ronald McDonald House, and we do welcome your questions and comments in the field of this Facebook post, whether you're watching it live or on playback. I think we're going to transition over to this room over here and check out a really cool-looking fish tank. Wow, that's amazing. Is that a saltwater tank, freshwater?
Honestly, I'm not sure.
Putting you on the spot.
Yeah, you're putting me on the spot. I do not know the answer to that, but there are resident fish, and we love them. We have a great guy that comes in and takes care of those fish for us, and the kids absolutely love to visit the fish tank.
You know, Amy, one of the questions we had on that preview Facebook post prior to doing this, we had a question from Kelly who asked how a ladies group could help out here at the Ronald McDonald House. And she asked whether the biggest need is for volunteers or even for financial. I imagine financial contributions are very much needed.
Yes. Running a 35-bedroom home is expensive, as well as the other things that we do as Ronald events that we have throughout the year that bring in funds to support the house. One of them coming up is actually our Lancaster County Community Auction. Community Auction is really a neat partnership with the Amish community. We serve a lot of their families here because of the proximity to Lancaster County, and they, in their way of giving back, do a one-day auction. It's on Tuesday, May 23rd. Starts at 11 a.m. and will run most likely till about 8 or 9 o'clock at night, and basically all items are sold. It also has a food sale that goes along with it, so if you like good Lancaster County cooking, it's the place to be on May 23rd.
You're watching.
And more information.
And you know, as we talked about, when this building was built in 1984, it obviously looked different than it does today. So in order to fund those bigger projects, and I imagine, who knows, another expansion could be needed. I'm sure, you know, capital projects are a fact of life for an organization like this. How are those funded?
Well, for our most recent expansion back in 2010, we launched a capital campaign to be able to raise enough funds to do the construction project, and as well as put all the furnishings and equipment in. We're always looking for a support in that way. It's an ongoing thing with a facility like this, so we're always looking for donors who are willing to support equipment and facility needs, as well as our operations. So there's many different ways for a corporation, foundation, or individual to be involved when it comes to financial support. It just wouldn't, you know, they would need to contact Karla or I, and we could have the discussion about what the current needs are with our organization.
Very cool. Let's take a walk down this hallway here, because there's another nice room around the corner. It has a view of the playground outside, which is really cool. I know I've seen a lot of kids playing out there, and yeah, look at this. Again, just another nice, comfortable, homey setting. And while it may not be best for Facebook, it is kind of dim lighting too, which I know is relaxing for the families, and I'm sure that's by design.
Yes, we like to keep a calm atmosphere for the families, you know, with the stressful times they're going through. This, again, Karla had mentioned earlier that we had a big group of people come together and talk about really what the look and feel of this place should be. And we, from day one, have been, you know, very calming colors, very calming atmosphere. Just to be able to set us apart from a hospital setting.
Very cool. All right. And what do we have here? I guess this is, like I say, another one of those settings where we have a fireplace, a piano in the corner and everything.
Yeah. So this is part of, we were actually in the original Ronald McDonald House that we opened back in 1984. And this space is just available for families. So if they have a group come in from out of town, say they're here for 3 or 4 months, and the grandparents are coming in to visit, this is a nice space for them to be able to sit and talk, because when this side, the original 13 rooms are built, when they were built much smaller, so there's not really enough room for visiting within the rooms. So this space offers that. We also do have in the one corner hutch over there a computer that's available for families. So that's in addition to the computer room that you saw before.
Very cool. Obviously, there's a connection to McDonald's. It's in the name. So some people may wonder, you know, how close of a connection is that? How is it linked to the famous restaurant chain?
Well, McDonald's is our founding mission partner. I mean, they started the first one. They were very involved with starting this one back in 1984, and they're still very involved. They're involved at the board level. They're involved in funding the organization, but one business can't do it all. So we rely heavily on the entire community to help fund this. It really it takes a village, I guess is what they say. But we certainly do value our partnership with McDonald's. Though the support that we see through the McDonald's is through the Central Pennsylvania Co-op, which a lot of people don't know, and that is a co-op. I believe they have 92 restaurants currently in an 11-county area, and so those owner-operators or franchisees of those restaurants are the ones that are supporting our house House here locally. So it's not a big McDonald's corporation supporting or completely funding. It is the local owner operators in central Pennsylvania, and they are truly to this day very generous to us.
And Ronald McDonald House Charities has a worldwide presence. So there's 5 Ronald McDonald Houses in Pennsylvania, scores of them across the country. So can you kind of put into context the work that happens here in Hershey that also plays out in communities across the nation and the world?
Yeah, we have, I'm not sure if Karla had mentioned, we have 366 Ronald McDonald House locations in the world. But each of us operate independently of one another. So the things that you see here, the things that we do here, the mission is the same, but a lot of the things that we do may be very different from what you're going to see in other states and other countries. But again, serving that one mission of providing a place for families.
Well, Amy, it's a nice place you got here and a very important mission. Thanks for doing what you do.
Thank you so much.
Amy Leonard is Development Manager here at Ronald McDonald House in Hershey. If you have questions for her or for Karla or any comments you'd like to share, feel free to do so on this Facebook post, whether you're watching it right now or if you're watching it on playback where we get most of our views. Feel free to add your questions and we will get some of those questions and comments answered. All right. Thanks to both of you for being here.
Scott, thanks so much. We appreciate the viewers being able to see the house if they've never been here before. And we invite you to come over if you'd like a tour personally. We'd be happy to do that for you.
Excellent. Thank you very much for watching from Penn State Health. This has been Ask Us Anything About the Ronald McDonald House.